Now, my task today is to provide a very broad and brief outline on frontotemporal dementia. And this outline will set the scene for the future presentations in this morning's session. As been alluded to, frontotemporal dementia is one form of dementia, and a less common form of dementia. And overall, it is estimated that frontotemporal dementia accounts for about 15% of all cases of dementia in overall. However, and why the name frontotemporal dementia? Because it's a progressive atrophy of the frontal and temporal brain regions. And here on these slides on the right-hand side, you see a healthy brain, and you can appreciate the change looking at the brain on the left-hand side and highlighting with the circles here the part of the brain that is showing predominantly shrinkage in these brain regions, frontal and temporal lobe regions. Why these regions? Well, still not clear, but why these brain regions are more vulnerable to frontotemporal dementia. And this is one of the challenges that many people are investigating. Now, as I said, it's a as I said, it's a less common form of dementia, but if you look at the people aged before the age of 65 years, or called younger onset dementia, it's the second most common form of dementia after Alzheimer's disease. And in general, the typical age of onset of frontotemporal dementia is between the age of 50 and 70 years. And certainly about 60% of people will have an onset before the age of 65 years. Now, the survival rate is one of the questions that many families ask us. How long will this disease last? And this is one of the difficult questions that we still don't have an answer to, because the survival is very variable, and it depends on the clinical presentation, so which symptoms the person will present with, and also whether it's linked to other forms of additional symptoms like motor problems, and also whether there's a genetic involvement or not. And again, some of these issues will be covered later this morning. In Australia, it's estimated that about 20,000 people are living with frontotemporal dementia, and it's probably an underestimate because of the difficulty diagnosing this disease. Importantly, the cost of looking after someone with frontotemporal dementia is enormous, and it's estimated to be about $125,000 a year per person in direct and indirect costs, which include loss of income and so on, and the fact that you will have a carer or family members who will need to take time to look after the person affected by the disease. Now, in the literature, three main presentations of frontotemporal dementia are described. There's a behavioral variant, frontotemporal dementia, which is the most common one, and with individuals presenting with marked changes in behavior and personality. What we see is disinhibited behavior or marked apathy, difficulty related to other people's emotions, and understanding emotional states of family members, difficulty understanding contextual social cues, and also marked accompanied by the loss of insight. So often people have difficulty understanding that they are experiencing these changes in their behavior. In addition to the behavioral variant, we have two language variants of frontotemporal dementia. The first one is called semantic dementia, where people with this form of frontotemporal dementia experience a progressive loss of knowledge about the world. And so it presents as a difficult, generally as a complaint by the person that they can hear word, they can read word, but they don't understand the meaning of these words anymore. And so it's an increasing difficulty to understand language, but it goes beyond language because it's really a broad, progressive loss of understanding of what things are. And then it impacts not just language, but also difficulty recognizing objects, faces, and also emotion. The other language presentations is called progressive non-fluent aphasia, which is a bit the other side of the coin from semantic dementia, in that in these people, the language is preserved, comprehension is preserved, but there's a marked difficulty with expressive language. And often there's distorted speech, difficulty making sounds that to put words together, and it's effortful and often accompanied by a loss of grammar. Now, with disease progression, what we see is a progressive overlap between these syndromes, because unfortunately we are dealing with progressive brain disorders. So with pathology that continues to accumulate across the brain, we see additional features emerging over time. Now, what we see is that also research has shown that frontotemporal dementia is part of a spectrum of disorders. So in addition to these clinical presentations, it's also associated clinically and pathologically with other disorders that you might have heard of, such as corticobasal degeneration, progressive supranuclear palsy, or even motor neuron disease. So clinically, we have a difficulty in that there's broad descriptions of these syndromes that are presented on the left-hand side in these nice little hexagons, but the clinical reality is more like this, where you have a person who will present a mix of features and evolution over time, which makes the life of the clinician slightly difficult. Now, clinically, it's complex. Pathologically, it's also complex. So what is happening in the brain? And overall, we know that 3 categories of pathology, and 2 of these are presented on the left-hand side of this slide, tau and TDP, and then in the little green box at the bottom, fuzz, account for about 90% of the pathologies that we find in the brain of people diagnosed with frontotemporal dementia. Now, the question is, how do the clinical presentations relate to what is happening in the brain? And that's where another difficulty arises. If we take the language presentation, so semantic dementia and progressive non-fluent aphasia, the story is quite simple. Semantic dementia in general is associated with TDP-43 in the brain, and a few cases will be associated with tau deposition in the brain. If we look at the progressive non-fluent aphasia, it's the other way around. Cases with progressive non-fluent aphasia tend to have tau deposition in the brain, and a few will show TDP in the brain. Now, if we look at the presentations with additional motor components, such as motor neuron disease, again, there's a clear differentiations or clear demarcations of what the expected pathology will be in the brain, TDP-43 and fuzz. Whereas the other types, corticobasal degeneration and progressive supranuclear palsy, are primarily associated with tau in the brain. Now, the most difficulty is with the behavioral variant frontotemporal dementia, which is the most common form of frontotemporal dementia. And unfortunately for this presentation, what we have is this. So the clinical presentation is unable to tell us anything at this point in time of what is happening in the brain of the person with this clinical diagnosis. So to look at this in another way is, and when you put all this together, one can appreciate the complexity and the challenges in relating clinical presentations and pathological changes. So to put that in a slightly different context, or another way is to, with frontotemporal dementia, is that we have a pathology that can lead to multiple symptoms, but at the same time is also a symptom or clinical presentation that is related to multiple pathologies. So again, you can appreciate the complexity and difficulties in tackling this disease. So there are a number of issues working current in frontotemporal dementia, and as I've alluded to, the main one is that the diagnosis remains very challenging. There are multiple presentations, multiple pathologies, and continuing evolution over time with changing features with the disease progression. Often there's also confusion with psychiatric disorders, and we'll hear more about that later on this morning, and also trying to understand the genetic contribution to these disorders. And the next speaker will discuss this in greater detail. Now, when families come to see us, often there are three questions that they ask. The first one is, what is happening to me? So the issue of diagnosis. The next one is, what will happen to me? So the question of prognosis and disease progression. And this is where one of the main challenges remain, is that predicting the disease progression remains extremely difficult in this disorder. And the third question is around treatment and drugs. And again, we are still, there's still a lot of work to be done in that area because there's no cure or disease-modifying treatments. And at the moment, treatments are more around symptomatology or addressing the clinical features such as behavioral changes or language difficulties. As you can appreciate, being a younger onset dementia, there's a great social and financial impact on the person with the disease, but also the family and their friends and their social network, and associated with the high burden of care on families. Despite these challenges, we have made a significant improvement in the past 10 to 15 years in our understanding of this disease, with the efforts of a large community of clinicians and researchers around the world. We are certainly able to diagnose FTD earlier and understand the progression of the disease better, although more work is still needed. Certainly, cure is still eluding us, but I believe that we're getting closer to this goal because of this international effort. Now, I'll finish that off here. Again, this is a broad overview of what frontotemporal dementia is. But I wanted to take this opportunity to thank the whole team here at Frontier in Sydney, at the Sydney University, and all our collaborators in Sydney, in Australia, and around the world, because it is really a group effort, and it is through collaborations that we'll be able to make further progress and understanding in this disease. And finally, I would like to thank all the families that have generously participated in our research projects over the years. Thank you.
Thanks, Olivier. That was a really good talk. So we have a question from Peggy, who has asked, can we tell how aware of their surroundings people are when they're in the severe stages of FTD?
It's a good question, a difficult question. With the progression of the disease, and even often in the early stages, there's a progressive loss of insight. So the capacity to self-reflect and understand what is happening to us, what is happening around the world, and how our behavior and actions impact on other people around us. And unfortunately, this is one of the main features, particularly in the behavioral variant of frontotemporal dementia. So I think that there's a greater difficulty in relating to the world in general. However, I think there are different ways to communicate with a person with dementia in the more advanced stages of the disease. And that's where communicating through maybe less language, because there are some problems with understanding understanding words and expressing speech, but through touch, through music, through actions, there's ways to communicate. I think also something to remember is that these things varies, so they fluctuate during the day and from day to day. So we all have good days and bad days, and it's the same for a person with dementia. So trying to be aware, more mindful of these moments where the person might seem more aware, awake, I think is also important.